Good morning, everyone. Thank you for joining us for today's webinar, PA Health and Wellness Contracting. PA Health and Wellness will also be presenting a webinar on claims processing at 10 a.m. tomorrow if you're not already registered for it. I'm Chris Fisher with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website later this week. Today's webinar is informational and not for credit. Feedback is important to us, so we'll be sending you a survey following the webinar. Please complete this survey, and if you are participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. This webinar is being presented by Tracy Celebrado, Director Provider Network LTSS with PA Health and Wellness. Tracy will provide an overview of credentialing and contracting documents for PHW. Your learning objectives for today include understanding the credentialing process, reviewing the contract language and rate methodology, and contracting process and timeline to full enrollment. I'll now turn the webinar over to Tracy.
Thank you, Chris. Good morning, everyone. As Chris mentioned, my name is Tracy Celebrado, and I'm the director here at Pennsylvania Health and Wellness for the Provider Network LTSS. I've been with Pennsylvania Health and Wellness since September of 2017 and transitioned here from another Centene plan in Florida called Sunshine Health Plan. I have worked with Centene since 2011 and been their network lead for the past 5 years in developing and servicing the LTSS provider networking department and also their contracting and provider relations. So I come here to Pennsylvania with experience having worked with nursing homes, large management groups, some of the multi-facility groups. So I'm very happy and excited to be working with you all in the Southeast and hopefully can cover some of the most important items on your list to discuss with us for contracting. We will be taking questions at the end of the session, and hopefully we can get to them all. But if we don't, Chris will be available to take those questions, and we would follow up with you immediately following this session. In our presentation, let me just get back one, sorry. In our presentation, just to give you some history on Pennsylvania Health and Wellness, we will cover who we are, what do we do, our products here at Pennsylvania Health and Wellness, who we serve, and how you can reach us. Centene is housed, our corporate office is housed in St. Louis, Missouri. We are in 28 states, soon to be 29 when we add New York. We cover many product lines in our Centene enterprise, which you see here, and we are the largest LTSS provider in the country. About Centene, we are committed to transforming the communities we serve, one person at a time. We focus on the individual. We invest in the communities, and we provide high quality, culturally sensitive healthcare coverage and service to millions across the United States and internationally. Our approach is to improve the health of our beneficiaries through focused, compassionate, and coordinated care. Our approach is based on the core belief that quality health care is best delivered locally. Our philosophy is to create local approach and job creation, have care coordination, remain compliant with healthcare and the information that we report, and also be culturally sensitive to our members present and future. We are working on implementing in several areas of the state of Pennsylvania. We're currently building our network in the Southeast, but in January we did roll out into the Southwest. Some of the timelines have changed for us in 2018, which shifted our outreach to many providers in the Southeast, but on January 1st, 2019, we do anticipate go live, and we'll be working with you all on a great partnership. At Centene and here in Pennsylvania Health and Wellness, we are offering Community Health Choices, which is our LTSS plan. We also have a DSNP program and an MAPD program. For all of our nursing home providers, we are pursuing all product lines, and we are looking to include both Medicaid and Medicare in your agreements. The Community Health Choices program is mandatory managed care for dually eligible. You will find that in most cases, your participants have a Medicare and Medicaid product line. Some of those will be Pennsylvania Health and Wellness Dual, which means we also cover them for Medicare and Medicaid. Our program is eligible to those 21 and over, again, who are eligible for Medicaid and Medicare, or qualify because of their level of care need provided by a nursing facility. Who's not eligible, Act 51 program participants, the IDD or DD, and residents in state-operated nursing facilities, including state veteran homes. We've included some information on our MAPD and DSNP plan. All information regarding Allwell is available on our website, and the coverage for our participants here includes 0 premium, 0 deductible, and 0 primary provider copays. On our DSNP, if they qualify, they can enroll in the dual eligible special needs program, and this will, they may be able to combine their Medicare and Medicaid coverage under a single plan to make it easier. And in some cases, we do have some participants that fall under that dual category here within Pennsylvania Health and Wellness. I've included some contact information, and this is just a general inquiry line that we have available to all providers, our provider services line. We do ask that all providers utilize this line because the calls are monitored. We do have a live team who will document and track your inquiry, as well as give you an incident number that would track that call. We have a general inbox information at PA Health and Wellness, so if you're not sure where to send an email to, this would be the most appropriate in that we manage the incoming requests to all departments as they come in and who they're addressing. And in follow-up to our webinar today, if you would like to see more information on our health plan, you can visit our site at pahealthwellness.com. What makes us unique in our program here at Pennsylvania Health and Wellness are our benefits and value-added services. So in addition to the coverage of coordination of care for all our participants, we also provide some value adds for them, including a cell phone program. We have caregiver access and support. We will cover for dental care, vision care, nurse advice line, and we also work towards a transition for those who are applicable from a nursing facility to the community. As you visit our website, we do include here for you all of the tools and resources available. We do also have provider notifications on our website. We call them provider bulletins. So it's very important as we work towards building our relationship with you that any staff who may have, some part in the management of our participant relationship, review the website and look at some of the resources. We do also keep on that website our training schedule, and with upcoming town halls and provider events that we'll have at the end of this year, it would be good just to keep an eye on that site so you can register for all of our events. Also on our website is our provider manual, and the reason why I present this in a contracting webinar is it's important for us to share with you where our relationship process guide is, and that's in the provider handbook. As we work with you post 1-1 and your teams, it's important to understand how the processes are within our company to make sure that your business with us isn't an administrative burden, and that you can easily call into our service line and log into our website and understand who's your point of contact for all items related to that partnership. We also encourage you to take a look at some of the resources available to make your administrative task easier in relationship with us. One of the items that we would look to work with you on is registration of EFT. And so as we work through the contract and as we get you built into our systems for business, we will work with you also to get you set up for registration such as EFT. Also within that website access is our secured provider portal. This is a site where you can verify eligibility, manage your claims, check authorizations. So if you do not have an EDI partner to submit claims through, this would be an alternative for you. And these are all of the tasks that you can accomplish in our secure provider portal. For us to register you as a provider in the portal, we have to get the contracting process completed because registration does require that we have you fully enrolled and with your tax ID number in our system ready for business. And here's our contact information for contracting. I will share this as a separate document with Chris for distribution to you all, but it's very important to know who your contracting point of contact is and remain in contact with them. So I shared with you our team's names, their titles, the areas they cover, their direct phone line, and their direct email address. I also included my information at the top, just so that if you need some further assistance, you are able to reach me either by phone or by email. And if I am not available by phone, just leave a message and I will follow up with you all. So our contracting process begins with a soft introduction between the contracting reps and the nursing facility point of contact. In our outreach that we did a few months ago, we were able to collect points of contact to outreach and share our interest to start building the agreement. When we do our initial outreach, we like to collect some information from the provider. This just gives us the details needed to request your contract. The state and our Centene corporate office is very particular about having adequate and accurate data. So what we find in many instances is that we have ID number that may not be registered with OLTL, may have changed in the course of time. But when you receive this form from us, if you have not already, we would just ask that you give us your legal name as it is on your W-9, and that is because all of our contracts require that we have the legal entity name. So if your business has a DBA, your contract has to read with that DBA. We also want to make sure that we have the correct Nancy PI or NPI, and also have your full Medicaid promise ID. And full is the first 9 digits and the service location. And the reason why it's so important to have those numbers on the front end is because Medicaid full promise ID helps maintain your relationship in the system, and any billing that you submit does require that you have the Medicaid promise ID in full. So for us to collect good data on the front end helps us to manage our relationship much better in the system and with you. So please just make sure that whomever is the point of contact working the actual documents internally at your organization is taking a look at how you've registered your information with the state and making sure that the information provided to us coincides with what is current. So this SIF form, I call it SIF, but the contract initiation form will collect that information. And once we get this back with a copy of your W-9, we're able to submit to our corporate office a request for a contract. And so as we collect the data, we would also like to make sure that the bottom portion of this contract is completed. So for nursing homes, as I mentioned earlier, we would like to include the Medicare and Medicaid products in your agreement as a nursing facility. So we would ask that you check the second box, Medicaid, Medicare. We'd also want to make sure that our ancillary provider box is checked for LTSS and our facility box is checked for nursing facility. So I can send to Chris this form in a mock of data as a reference tool so that you can use it as a guide if you have not completed the contract initiation form. We cannot request any contracts from corporate unless we have collected this form along with the W-9. And it's just to make sure that we have the legal business name on the agreement. While we are requesting your contract and upon receipt of that initiation form, my team will send you our enrollment packet, which for those of you who may oversee multiple facilities could be quite time consuming. And so just as normal business practice, we get the checklist out so that you could start working through these as you wait for your contract. The checklist is very specific in what we need, and we also have to make sure that you are submitting to us all in one package, all supporting documents with your contract. What tends to happen is that we have providers who are working with other MCOs, or they have multiple facilities who are submitting documents and may piecemeal these papers to us just to move through the process. But until we have a complete package, our system does not allow us to submit any contract packets. So for us to submit your agreement and your completed documents, we would have to have everything on this checklist submitted with your contract all in the same email. And so if we find that we did not receive anything, you may get a follow-up call from the representative that you worked with in attempts to collect the missing document. And what we try to avoid is any document with an expiration date to expire in the pursuit of missing documents. So for safety measures and to ensure that we could get you in the system, we ask that we just get one email with all required documents along with your contracting packet. So page 1 of your enrollment packet will include the checklist items that are required for contract submission. What's best is if you're unsure of what we are asking for here, that you contact your contracting rep immediately to discuss. If it is easier for you to have us there at your facility working through this paperwork, my team is always in the field down there in the Southwest, and they are more than willing to set up a time to sit with you and go through all of these documents. They are also making follow-up visits to those facilities where we may have a document missing and just need a signature or just need to, collect something. So our goal is with all nursing home providers in the Southeast and their contracting process is to have this all completed no later than the end of October. And that's because we want to make sure that as we approach the January 1st go live in the Southeast, that all of you are visible in our system and do not have any disruption in the administrative process, and that you are fully registered for all of our websites that you need access to, and that you have the full onboarding experience with training, orientations, and town halls. So for us, the movement of the contract is very important. As you go through the preceding pages of this application, much of it does not apply to you as far as the credentialing type and these boxes. In our system of managed care, all network providers are required to complete the credentialing process. So to keep it simplified for us, we utilize the same form for all providers. However, each one has different requirements. So as you scroll through the next few pages, what you would be looking for is our skilled nursing facility. So here are the documents that we would require you to send in along with your credentialing application. As you scroll through pages 6 until the end of the enrollment packet, it's very important to stay consistent with the business legal name. If we have variances in the legal name, we cannot move forward with the contract, and that's a compliance requirement. So if on your W-9 it says ABC Nursing Home, DBA, McKeesport, that is the business name that you would have to use on every document that asks for business name. As you scroll through, it's important to enter a data entry into all fields that would apply to you. If a field does not apply to you, please put N/A so that we know it wasn't a box overlooked, but rather it was something that wasn't applicable to your facility application. On this form, we also collect your billing information and your mailing information. Address is very important here at Pennsylvania Health and Wellness. So there are 4 addresses that we collect from every provider. In some instances, those addresses may be the same, and in some instances, those addresses may not be the same. So billing information, this address is the address that if you are collecting any checks or you have paper remittance, where you would want that remittance to go. So if your billing office is off-site and they are a central collection location for all paper checks and for paper EOBs, that is the address that you would want to be in this box. If your physical location is not the same as your billing location, you do not want to enter that here. Mailing information, again, is another address that we collect. And mailing information is pertaining to all needs. So if we need to send you an update, or we need to send you a notification on a change of process, where do you want your regular mail to go? If it's the same as your billing address, plug them both in the same. If it is not, make sure that you separate the two. Another address we obtain through your contract, and I'll get to that in a few minutes, is your notification address. So notification address is the person who would receive all notices regarding your contract. So if something changes as far as regulatory language, or if we are rolling out another product line and need to send an amendment request, that would be the notification address. The 4th address we collected here is the physical address, and that's where your physical office is located. So it's important to make sure that when you complete these enrollment apps, that you are putting the appropriate address into those fields, because if we don't have a good address, you could see some issues, and we can make the updates, but all of our provider office location information goes into our provider directory. So if we don't have a good address, it won't be reflected properly in our directory. We also collect your office hours, and we do post service hours and all of the information in those data fields on our website. And it's important because our directory is used as a tool for participants to know the business hours when they can contact you. If you are open 24 hours a day, we would ask that you put that. If you are open from 9 to 5 but have an answering service after 5, just put the 9 to 5 so that we can make sure that our participants know the hours of operation and how to contact your office. Another important piece of information that we collect on this form is your insurance information. Our company does require that on all policies we have the coverage amount and that we have the effective date and also the expiration date. So if in your completion of this packet you realize that your policy expires on 9/1 of 2018, we would have to wait until you had an updated policy that you could present to us, because we could not process an application with an expiring date that is so close to when you submit. So if it's within a week or two that you complete this and something's about to expire, it's just best to wait until you get that update and let us know, so that we don't overlook anything in the system. We do also collect certain information as far as license numbers from our network provider. In this area, you would include your facility license number. Now, if you are submitting for multiple facilities, we would ask that you only complete one application per facility. So we wouldn't accept more than one license number in an enrollment app for your facilities. Each facility has to have their own credentialing application submitted with the contract. Servicing counties, also important. We want to make sure that you let us know where you are servicing. Again, if you have multiple facilities or facilities in the Southwest and now you're contracting for the Southeast, we would not want you to indicate that here. Servicing county is applicable to the facility location that you are completing this for. We are also required to collect confidential information. Yes, no. Please make sure that you go through this and select either or. If checklists are not completed, we do have to return back. Our team here is not allowed to make any changes to documents. So if anything would be missing, we would have to work with the provider to collect. We couldn't even collect it over the phone. We do require all providers to send completed disclosure of ownership. This is a federal requirement, and it covers all of the ownership and control interest by percentage. Again, it has to be fully completed and returned to us. We also include for you the instructions on how to complete. If you are unsure or need to just get some clarity on questions that are asked, please reach out to your contracting rep to walk through this. We also have an attestation here. At Centene, we do require that anyone, whether it is in a nursing facility or home and community-based environment, that all with hands-on contact with any participant have a background screening done. It is important to make sure that as you attest on behalf of the agency, that you also validate that all personnel with hands-on contact to participants also have the appropriate background screenings. This attestation simply says that all employed and contracted providers are required to have one on file. And then we have our provider data form, which is a collection of data. This form is really to make sure that we've got accurate data and that we are submitting this to our PDN department to make sure that everything collected is current. And then we also include for you a blank W-9 that you can use to submit for your CIF if you don't have one, or you can just keep it on file for future use. And so I'll move to our provider agreement. In our world of managed care, we attempt to have more standard agreement language than non-standard. Standard agreement language for us means that there are no changes to the term. Non-standard means that the provider has done a red line to make any changes or request any changes that may be required from their legal counsel. So when we get the contract form back and we submit it to our legal department, they send us a Word version that is locked, but it does track any changes. So if you are a facility whose entity requires certain contract language, you will have the ability to amend the agreement through a red line. And once we get that back, we would then send it up to our legal counsel in Centene Corporate to assess the risk. So there are parts of this agreement that when we have a red line change and assess the risk, it could be a significant risk. And in some cases, when we assume that the risk is significant, we then have to go into negotiation with the provider to find a meeting point where we could get a change to the language, but it may not be as significant risk for us as a health plan. Then we have some risk that is a health plan decision. So at our level, we can negotiate with you whether or not we would be able to accept those changes. And we have some changes, risk assessments that are not allowed. So if a change is made to regulatory language, sometimes we find that we can't change it, and so we do have red line requests that we could not change the language due to the fact that it could be regulatory language or a high level of risk that the health plan would not approve. So if you have any questions on your contract or find that there's language in here you don't necessarily think should be here or that you would need to amend, we're more than happy to discuss that with you, and you can reach out to your contracting rep to initiate that discussion. As we discussed on your enrollment application, it's important on page 1 for us to have your legal business name. When you do get this back from us, please just make sure to check page number 1 to make sure that it represents what is on your W-9. As we scroll through, the first few pages of our agreement are standard language terms from our Centene Corporate. So in this agreement, you will find language that is specific to Centene requirements. You will find regulatory language, which comes from our state partners, OLTL, where they say we need you to have this language in the agreement. We also have language specific to the product line. So there's federal and regulatory language on, Medicare CMS, on the LTSS world, that's product line specific. And so as you go through the first few pages, it's important for you to understand how do we agree to provider disputes? How do we define a contract term? Your agreements are valid for 3 years, which means unless you come back to us and say, I would like to negotiate my agreement, all of your agreements are automatic renewals after the first 3 years, and then we then renew every year after that. As we discussed, the addresses and the enrollment application, it's been very important to complete this page number 11 on the PDF form to include who would receive all notices. So if you are a facility that does not want any changes made, whether it's regulatory, federal, or health plan related to your agreement without notice first, that's where you would put this address and whom it should go to. It's important to make sure to put a name on there and their title. And if that person happens to change over time in the 3 years where the notices should go to, you should let us know at the health plan that notification person update needs to be made and what the change is. We do ask that any changes made to this agreement are sent to us in writing. We do have our signature page here in the agreement, page 13 of 47. On the provider side, we need to have your signing authority and their title. The signature does have to be clear, legible, and free of any strike-throughs or whiteout. We could not accept an agreement that has any type of markings like whiteout or strike-through. Once we get your contract back and we process it through, the health plan does a counter signature and you should receive an executed copy. The agreement is not legal and binding until we have a counter signature. And for our OLTL requirement, we are required to send, starting next week, signature pages for all nursing facilities who have signed their agreement and are in the contracting process. So it's very important for us to have a clean page. As you scroll through the agreement, you will find a product participation page, which would include Medicaid as attachment A and Medicare as attachment B. And then the next page coming up is our Schedule C. It's very important if you are a nursing home group with multiple facilities that you include all of your facility names on the Schedule C. And the reason that I say that is because of naming convention and how we would look for your providers in the system. Your legal name may have your facility name, but if you have 4 or 5 facilities under one legal entity TIN, this is the page where you would let us know all those facilities that you would include in your agreement. Now, considering compensation and the methodology that may be applicable to each facility, we can add compensation schedules to this agreement that is applicable to each facility. So if you have 5 facilities and 3 want CMI and 2 want floor rate, we will include 5 compensation schedules. We will apply the TIN and NPI associated with that rate page and make sure that your agreement is all-encompassing of all your facilities that are included in the contract and the rates that we should load them for. We work through the product attachments again, program requirements, federal requirements, regulatory requirements, and page number 44 of 47 would start the compensation schedule. And so as we talk through rates, Centene and PA Health and Wellness went with a methodology option for all of our providers. One option is the per diem, and the per diem rate is the rate of 4 quarters prior to the implementation, and it is an average. So what we do is we take quarter 4 of 2017 and the first 3 quarters of 2018, and we create an average, and as daily per diem is written into your agreement, and the rate does not fluctuate or change for the next 3 years, we lock in the rate for the term, because administratively it becomes a challenge to process payment rate changes, only because by the time that we get the rates loaded to the time that the system recognizes the rate and we process payments, if we do too many changes administratively, we end up in a lot of recovery modes or recoupment modes or underpayment modes, and that just becomes a challenge for us to manage here, and I'm sure on your end too. So for that reason, when the per diem rate is selected, it is a lock-in rate, and it is for the term of your agreement with us. If you select Case Mix Index per diem, this is the CMI rate that is published quarterly, and in this agreement, if you were to select Case Mix Index as your rate, we could move forward with your agreement, and this rate would be published in our system every quarter thereafter the signature of your agreement. So we would not have to wait until the end of quarter 3 of 2018 to process to wait for the 4 quarters with a CMI selection. We can get this done, and then every time there is an update to our system, all facilities are updated with the adjustments. As we move down to Table 1, we are also including your payments for Rev Code 100, which is the room and board. This has to be 100% of the per diem selection that you make in the box above for the per diem. And then we are also including disproportionate share. If that is something that was paid to you from the state, it will be paid to you from Pennsylvania Health and Wellness. We also include our bed hold days. It's very important as you complete this agreement that you have a rate in all of the applicable boxes, and you should work with your contracting representative to make sure that all rates are in. In our system, configuration will not load a rate unless we have a rate in the agreement and that the rate can be loaded. So for the up to 30 days bed hold, we are paying 100%, and then for those that are related to hospitalization, we would pay 33% when it's up to 15 days. If you are a facility who is receiving payment for vent and trach, we do also reference the state guide for payment and include those into your contract rates here. Again, we would want to make sure that rates are hard coded into the agreement, so that way we do not have any type of load errors into our system. And then for our exceptional DME, it's my understanding that OLTL did make some changes to the exceptional DME program. I don't have any FAQs available at this time on the change, but I do know that there's been discussion for exceptional DME for the health plan to work directly with the DME provider. For now, we're keeping these in the agreement, and it is the nursing home's decision whether or not they would continue in the program to work with DME directly, or if they would have the DME providers work with the health plan. And then we also include in our comp schedule all of the ventilator and supply codes and rates that we would pay, which is up to a maximum of $80 per day. And we also include respite in all nursing home agreements with the HCPCS code. It is a per diem, and we pay 100% of the allowable. So as we close out this webinar presentation, I will send out the contact information, and please let us know in your update to Chris if you're in the process or if you are looking for someone to contact you, so I can make sure that everyone makes immediate outreach. But I thank you for your time. Chris, I'll turn it back over to you.
Thank you, Tracy, for the great information today. At this time, we will open up the question and answer portion. Please submit using your question box on the right side of your screen on the Go To Webinar pane. Tracy, we did have two questions that came in overall. The first question that we had was if the slides would be made available for the presentation today. For those of you that are wondering, PA Health and Wellness hasn't made the slides available for us to share here at PHCA, but they're going to be getting us the contact information and things of such to get out to you what they want to put out. So we will get that to you. Tracy, then we have two questions here from one person. We submitted the contract initiation form and credentialing information in mid-July. How long does it take to hear back regarding the submission? And as of right now, they have not heard anything to date.
Okay, if you could collect that information, Chris, and send it to me, I'll make sure that there's follow-up. We are working with many providers in the Southeast region, and so if it has come in, I will make sure that, you know, the providers get it immediately, because we do need to get these closed out.
Okay, and then along that same line, Tracy, they are in Bucks County, and they submitted their info to Tanisha, because that's who they were told was their contact. And according to your sheet there, she's assigned to Philadelphia, not Bucks County. So they're just wondering if that matters at all, or if they need to do anything else there.
I can make the connection. Once I have the contact information, I will work with them to get everything completed. Tanisha has moved to Philadelphia, and so Michelle and Khadijah are our contracting reps for Bucks County, and we'll work with them to get this closed out.
The next question that we have is, who is required to collect the income?
Collect the income, I'm not sure what that means.
There's nothing else with that question. Let me see if I can get further. There's a question about the status of transportation for nursing homes and who covers the cost.
Yes. So we are in discussions with OLTL on transportation. It's my understanding that transportation is inclusive of the per diem, and I think that there was some meetings late last week between PHCA and OLTL on that subject. We are also sending out a communication on our process, but at this time, transportation is not an added carve-out to the compensation schedule for nursing homes.
Yes, and Tracy, the income that they are wondering about is the patient pay.
Yeah, so we've had several discussions on the patient pay and the submission of claims with the patient pay amount. For our claims call on tomorrow, I will have that information, and then I can get the response from our claims and finance team who manage that portion.
Yeah, for that question, just at the nursing facility can still be responsible to collect the patient pay. I'm not seeing any other questions. I'll give it another second. One final question here for Tracy is, so if transportation is included in the per diem, could there be negotiations to have our rates increased to cover the cost as it continues to be a significant increase in cost?
I will have to take that back to our senior leadership. I know there are discussions as a whole on nursing homes and transportations. I just don't know what the outcome of those discussions have been. So I'd rather take it back and present it as a question from our meeting today, and then I can respond to you, Chris, with what the feedback was for forward chair.
Okay, and then we have a few other questions here that there's information that PHCA is already out on the website about enrollment and rollout throughout the state of Pennsylvania, and I'll make sure that we get information to those individual questions as we go forward. So I want to thank Tracy for her time and remind everybody that a survey will be emailed later this week, and a recording of today's presentation will be made available at phca.org. Please take time to complete the survey, and thank you again to Tracy for presenting on this topic, and have a good day, everyone.